Go for it.
Good evening. I'm Sean Gale, Assistant City Manager and spokesperson here at the beautiful city of Miramar. Thank you for joining us for the third in our bi-weekly series, Conversations with Mayor Messam. This is the healthcare edition, and today we're going to be focusing on healthcare in the time of COVID-19. On today's Live with the Mayor, we're joined by Dr. Brajesh Mehta. Dr. Mehta is a interventional surgeon at the Memorial Neuroscience Institute. He's also the director of the Comprehensive Stroke Centers for the Memorial Healthcare System. And he is also a founding member of the Tri-County South Florida EMS Stroke Coalition to help optimize stroke across all hospitals. We also have today joining the mayor, our own Miramar Fire Rescue Captain, Manuel Esparza. Captain Esparza is a trained registered nurse and a paramedic. Our panelists will be answering your questions during this broadcast today. And so we invite you to type them in our comment section and we will get to them during our question and answer session. Right now, we're turning things over to Mayor Messam for his introduction. Mayor Messam, go ahead, sir.
Thanks, Sean. It's great to be here for another episode of Conversations with Mayor Messam. It's been a pleasure, actually, over the last 2 episodes to bring dynamic topics in terms of the city's reopening, as well as resources for the business community that we had on our last episode. But this episode is perhaps one of the most important because it deals with your health and any emergency response that you may need in dealing with any conditions that may impact you or a loved one. Some of the questions that have been sent in terms of, is it safe to go to the emergency room? I don't think I have COVID-19. I have another ailment or another issue, but is it safe to actually go to the emergency room? My child isn't feeling well. Should I take my child to the emergency room and expose them to perhaps what may be COVID-19 out there? Well, that is why we're having this topic today with our friends at Memorial and our fire rescue department. So just listen up. We have some great information in store for you this episode. Make sure to submit your questions so that we can have them answered for you. And I'm just so excited that you have joined us today as we continue to adapt to our new world. So thanks so much, Sean, and back to you.
Thank you so much, Mayor Messam. Now we're also joined by Dr. Brajesh Mehta. And like I said, Dr. Mehta specializes in treatment of acute strokes, brain aneurysm, arteriovenous malformations in adults and pediatric patients. So Dr. Mehta, if I could turn it over to you now, sir, for your introduction.
Thank you very much, team. It's an honor to be here, Mayor Messam. This is a very unique and unprecedented time for our community, and for acute strokes, which is what I specialize in. I appreciate the honor of going over some of the precautions and steps we've taken to protect our community. So as many of you may know, every May is Stroke Awareness Month, and we've spent a lot of time educating the community every year about the stroke signs and symptoms. So as you can see here on this schematic, this is an example of a stroke in an individual where there's a big blockage of an artery in the brain. And every minute that elapses, millions of neurons are at risk for irreversible damage. And so it's imperative that if a patient or a loved one is experiencing signs and symptoms of a stroke, such as weakness in the face, droopiness of the face, difficulty raising the arm or leg, or trouble with speech, immediately call 911 because time is of essence. Every minute that elapses is an opportunity lost. And these days, we have a lot of treatments that are available, innovations that have occurred just in the last few years, in fact, where we can treat patients in the cath lab, remove major blockages of arteries, and immediately restore blood flow to the brain to the point where patients are immediately lifting their arms and legs right there on the table in the cath lab. And so more and more, we're seeing better outcomes after these treatments, and that reinforces our faith and confidence that something can be done for acute strokes. Before, patients were typically bound to nursing home because of the lack of these types of innovative treatments. So we've worked very closely with our fire rescue agencies, such as those in Miramar, and we've developed these protocols that are among the first in the country that we launched with Miramar Fire Rescue, in fact, just a few years ago, where if a patient is experiencing a possible stroke, the paramedics immediately dial the Memorial Stroke Hotline. We're able to assess them via FaceTime and able to advise whether it's a stroke or not, and immediately activate our cath lab, such that by the time paramedics arrive to the hospital, we're at the ready, whether it's day or night, and we can take these patients and have them treated promptly, because it's all about the golden hour of acute stroke care. The faster we treat them, the better the potential outcomes. Now there's these other innovative platforms, artificial intelligence technologies, where we can see the blockages of arteries in the brain as soon as CT scans are being done, such that we can promptly activate the cath lab once we get the imaging updates on our mobile phones, regardless of where we are, whether at home, in procedure, in the cath lab, in our office. So it really saves us countless minutes. And these advances have been a game changer for our system. So, I just want to touch a little bit on what we've done during the pandemic, because it did create some challenges in terms of maintaining patient safety. And the three main pieces of information that I want to relay to the community is, in the hospital, we've, implemented the strategy of testing every patient that comes to the emergency room, especially if they're going to be admitted to the hospital, isolating those patients that are tested positive for COVID-19, such that we keep them in a separate area from those that are not infected, and protecting all the medical staff and personnel that are involved in the care of every single patient with having the necessary PPE, which is personal protective equipment, so that we minimize the risk to our team members, to our cath lab staff, to our nurses, and the physicians. So as you can see here, this is an example of different pathways that we've educated many of the stroke centers in the state of Florida through a webinar that we did for the Florida Stroke Registry. And we have created a protective shield within our cath lab such that for infected patients, we don't transmit that virus to the next patient for whom we might be doing a procedure and create a risk for them. So just want to reassure the community that we are ready and safe, safer than ever before, in fact, to help each and every patient that's coming in with any type of medical issue.
Thank you so much, Dr. Mehta. That was very, very informative. Thank you for breaking it down to us in so many different ways. We're going to go now to Captain Esparza. And first responders have been at the forefront of COVID-19, doing everything that they can for the safety and security of our community. So, Captain Esparza, could you go ahead now and address our viewers, sir?
Well, thank you. Good evening. Thank you for having me on. In this time of the pandemic, it's crucial that the persons out there that are feeling any kinds of symptoms of maybe stroke symptoms or chest pain, flu-type symptoms, that they call 911. Reach out to us. Let us come out. Let us evaluate the patient, see what's going on, and do the proper treatment and care for the person. We have PPE, protective gear, that protects us from the patient and protects the patient from us in order to evaluate the patient and follow the proper treatment plan. And as the doctor stated, now at the hospital, it's safe to go to the hospital. Everybody's wearing the protective gear that they need to do. Everybody's being tested, and the persons who are tested positive are isolated from the rest of the population.
So, Captain, while we have you on the floor, sir, could you please tell us, are the number of coronavirus cases still rising? Are we seeing a decrease? What are we seeing out there in the public?
We do see an increase in cases. Unfortunately, as of this morning in Miramar, we have 520 confirmed cases. That's up by 12 from yesterday. But with that being said, there's a lot more persons being tested. So you are going to have an increase in numbers. If you take the numbers that we have, the 520 confirmed cases compared to the 140,000, give or take a few residents that we have in Miramar, that's a very low percentage. That's less than 0.5% of the population in Miramar that's actually positive. So that's not a bad number. It's not a great number, but it's not a bad number.
Thank you so much, sir. Dr. Mehta, if we could come to you, sir. When COVID-19 just came on the scene, we had different iterations of signs and symptoms of COVID-19. It was categorized as flu-like symptoms in the beginning. So can you tell us, is it possible to have the flu and COVID-19 at the same time?
Yeah, so that's a great question. The signs and symptoms do overlap between the routine flu compared to the COVID-19 infection, such as difficulty breathing, fevers, muscle aches. The main point that we have emphasized with our community, who are now ever so vigilant with all the news of the pandemic and the severe respiratory issues that it can cause, is that if you're not sure whether it's the common flu versus COVID-19 or a cold simply, now there's widespread testing available. As based on the numbers that the captain just mentioned, it's all about that denominator increasing and making sure that we test, a large segment of the population to ensure that they're not transmitting that infection if they do have it. And overall, it's important to also know that most of the symptoms are mild. And so it's only the very severe cases of, COVID-19 infection that get admitted to the hospital. But the vast majority are, very mild symptoms.
Thank you so much, sir. Now, Mayor Messam, if we could pose this question to you. The question is, where can I get COVID-19 testing in Miramar?
Well, there's actually a couple of places within our city limits where you can be tested. At the Vernon E. Hargrave Center, located just east of the Turnpike Overpass and Miramar Parkway. That facility is open every day from 9 a.m. to 2 p.m., and we have the capacity to test over 200 individuals per day. In fact, the testing is absolutely free. You can be symptomatic or asymptomatic. There are no appointments that are required, and it really is significant that this location is in the heart of historic Miramar, which is in a zip code that has had significant numbers of positive cases. So we just want to ensure that those who are most at risk and those who simply want to be able to see if they find out if they are actually positive. Another good, unique quality about this testing facility is that you can bring your children there. Adolescents can be tested there as well. You just have to bring a birth certificate for that child as a guardian, and the adult should bring a valid ID.
Thank you so much, Mayor Messam. Now, Captain Esparza, what tips can you give our viewers for someone who has high blood pressure in this time of COVID-19?
Definitely take your blood pressure medication. A lot of times persons who take blood pressure medication feel good. They might take their blood pressure on a daily basis. Their blood pressure is within normal limits. And they might say, well, it's normal. I skipped my medication today. I don't need it. Medication needs to be taken as prescribed because you need to have that therapeutic level of medication in order for it to work. So if you skip a day or skip 2 days, it messes up the threshold level of the medication, and it puts you at a higher risk of stroke or heart disease because the COVID-19 virus, as one of the things that it causes or could cause is coagulation of the blood. So you want to have smooth muscle for the blood to flow easily and avoid those type of situations.
Awesome. Thank you, sir. Dr. Mehta, if we can come to you, sir. Now, we know that we have been sheltering at home. We have had safer at home orders. A lot of people are choosing to stay home during this time. But I need to ask you, if someone has a health condition which requires, routine visits with their physicians, is there a hold due to COVID-19, or is it now safe for them to schedule their follow-up appointments?
Right, that's a very good question. We have spent a lot of time at Memorial making sure that when we reopened our medical facilities, our outpatient clinics, that it was indeed safe for those who had medical conditions or questions about ongoing symptoms, that they would feel safe coming to the hospital. So just like we have practiced social distancing in the community, at other businesses, we've instituted the same policies and guidelines within our clinics in the outpatient setting. And so we screen every patient before booking an appointment, making sure they're not exhibiting any active symptoms of the virus. And then also, once they arrive, making sure that patients are spaced apart within the waiting areas, at least 6 feet, and staffing levels within our clinics have been adjusted to ensure that none of the areas, the physical exam areas, the hallways are crowded. And so with these steps, I do feel confident that it is now safe for patients to have clinic visits. For those who may not have the ability with transportation issues or mobility issues to come to clinic, with all the technology such as what we're using right now with telehealth, it is now more important and allowing us the convenience of seeing those patients from the comfort of their homes and us being in the office. And so we have now seen a significant uptake in our outpatient volumes as a result of these technologies.
Awesome. And while I have you, sir, could you speak to the issue of blood donation? Is it safe to donate blood during this time? What should people consider if they're trying to donate blood? Can you speak a little bit to that?
Sure. So, with blood donations, one of the questions that does come up as part of the screening criteria to ensure safety of any potential recipients is if you've had any prior infections, including with COVID-19. And so it's important to still consider donating blood products due to the, ongoing shortages of red blood cells in the hospital for transfusions, but they will have to make sure that they're screened appropriately, whether it's through the Red Cross or other donating centers, to make sure that while intentions are good, we don't compromise safety of the recipients.
Awesome. Thank you so much, sir. If I can go to Mayor Messam with this one. Mayor Messam, could you tell our audience, why is it important to maintain a healthy lifestyle, especially during this pandemic?
It is imperative that we all remain to maintain a very active and healthy lifestyle. Obviously, we can take all the precautionary measures to ensure that we prevent ourselves from being infected by COVID-19, but we never know how we may be impacted or infected. So to give ourselves the best chance to sustain any impacts from an infection by just eating healthy, staying active, you want to make sure that your immune system is as strong as possible. So to give yourself the best, absolutely best opportunity to be able to defend against any impacts should you be impacted by COVID-19.
So, sir, you spoke earlier about testing sites throughout Miramar and where our audience can go to get testing without appointments. But could you speak to the issue of health insurance? Does somebody need health insurance to get tested? Do they need appointments at any of the sites, or can they just visit any of the sites at will?
Well, the site in Miramar, located at the Vernon E. Hargrave Youth Enrichment Center, is absolutely free. You do not need any medical insurance or health insurance to be tested. It is covered by the state's allocation of viral testing. It's a very quick test, and we encourage everyone, if you feel that you've been exposed to COVID-19, someone who may be infected, or you may not be feeling well, or if you just want to know, you can come by and have the test done absolutely free.
Thank you so much. Dr. Mehta, if I can pose the next question to you, sir. So we know that not everyone exhibits symptoms of COVID-19 in the same way. As a matter of fact, some of us are asymptomatic, even though we may be carrying the virus. So could you speak to the issue of asymptomatic patients? Are they less contagious or more contagious? Can you talk a little bit about that?
Right. So the information about this virus and the knowledge that has been gleaned from a lot of the worldwide research that has been done, first in the initially affected areas such as East Asia, and then Europe, and now in the US, the knowledge and the information has certainly modified our approach to how we protect our community. The guidelines from the CDC is the reason we have been advised to wear masks is because the asymptomatic patients can certainly transmit the virus, and that's one of the unique things about this virus is, after that incubation period, and once a patient starts exhibiting symptoms, they may have already infected several other people. And so by wearing the mask in the community, in crowded places, we're doing a service to everyone by protecting them in the event we have caught the virus. And so, as I mentioned earlier, while most of the cases are mild to asymptomatic, we cannot take this lightly. We're, really protecting everyone by taking these necessary social distancing steps and guidelines.
Awesome. Thank you, sir. Captain Esparza, could you talk to us a little bit about age groups of people? So, someone might ask, I'm not in my 70s. I'm not in the endangered group of individuals. I don't consider myself high risk. I don't consider myself vulnerable because of my age. Could you talk to us about what we should be doing regardless of our age?
It's a good question. The COVID-19 virus does not discriminate against age, sex, or background, or even financial being. It's an equal opportunist. It can affect anybody equally. What I need to suggest is that let's use some common sense. Let's keep our social distancing to at least 6 feet. Let's use our masks. Let's use our gloves. When we do use our mask and gloves, I see it. I'm sure everyone out there sees it as well. You'll see the persons in the car driving with their mask and gloves on. Just keep in mind that when you're in a store or outside of your home and you're touching things with those gloves, you're potentially putting contaminants on your gloves. And then we're reaching for our phones with the gloves on, and we're doing all the things that we do. And now we get back in our car, and then we've contaminated our car. And it's a snowball effect. We take that back to our house. Everything's contaminated. So if there's one thing that I could suggest would be have a bag in your car where you can throw away your gloves. Have a paper bag where when you take off your mask, and it's a reusable mask, you put it in a paper bag so that it doesn't hold moisture. The papers kind of absorb that. And definitely when in the stores, don't use your phone. Put the phone away. It's okay if you don't have a phone for 20 minutes in your hand. It'll avoid circumstances in the future. It really will.
So then can you talk to us, sir, then about now that businesses are reopening and we're going to be out and about a little bit more often than we have been for the past couple of weeks. What should we do when we return home? What measures should we take when we get home?
Well, a must is washing of the hands, and washing of the hands for a minimum of 20 seconds, which seems like a long time, but really, if you think about it, if you wash your hands correctly, interlocking the fingers, top and bottom of the hands, go up a little bit past the wrist. You can wipe your face off. While you're out and about in the public, don't ever touch your face, because that's you're just getting the virus closer to you. And that's just this goes for any type of a virus, really. There's a lot of things out there, and you hear it all the time. The the keypad at the ATM, or doorknobs you coming in and out of stores. Everything, you have to treat everything like it's contagious. So washing of the hands, good hygiene is a must, really.
Great, great. Thank you so much, sir. That was very good. Dr. Maida, if I can pose this question to you, sir. Captain Esparza just spoke about washing of the hands, but tell us about washing what we wash with. Does organic soap work just as well? Is there a certain type of soap that we should be used to be preventing COVID-19 as an antibacterial soap? Talk to us about what we should be using to wash our hands.
Right. So there's been a lot of debate and discussion about this. And, overall, based on the current research and FDA, CDC guidelines, there's really no difference between the, antibacterial soaps and the organic natural soaps. It's as long as, you follow these protocols as the captain described, the practical steps, whether you use one soap versus the other or a hand sanitizer, is taking the time to make sure that you cleanse your hands for at least 20 seconds. And the natural, soaps versus antibacterial, again, there's no difference. We have naturally occurring oils on our skin, and many times the antibacterial soaps, they might kill some of the protective bacteria that we have on our bodies. So certainly don't want to go overboard with some of these cleansing techniques and protocols.
So can you speak a little bit about infants, sir? Because when you talk about the washing of the hands, it's a little bit more difficult when you get into an infant or a toddler. Can you talk to us about how do we handle that population when we talk about keeping our hands clean?
Right. So it's a good question. Thankfully, at least from the research and the studies we have come across, the infection rates in infants and children are much lower compared to some of the elderly population because of the comorbidities that adults and some of the elderly population have, such as cardiovascular risk factors, diabetes, high blood pressure, things like that. But in terms of taking special precautions to make sure that we don't, unintentionally expose our young ones to the virus, still need to make sure we handle them with the same safety precautions by doing the hand washing before we hold them, before we feed them, but also making sure that we use the safe, the baby soaps rather than the more stringent soaps and cleansers that adults can tolerate so as to not cause irritation.
Awesome. Thank you, sir. Now, working with the community is the best and most important way to combat COVID-19. Can you speak to, Dr. Maida, to any thing that you have done with the community, any activities that you have done with our community to combat COVID-19?
Sure, absolutely. So, with acute stroke care, we always say it takes a village to adequately treat patients coming in with strokes and to ensure a best outcome possible for each and every one of them. So, over the last 5 years, we have brought together all of the EMS agencies, including Miramar Fire Rescue, as part of our South Florida EMS Stroke Coalition. And the goal has been to educate them on our acute stroke protocols in the field. So as an example of one of the training videos that we made in partnership with Miramar Fire Rescue. And it allows their paramedics to learn what the signs and symptoms are for stroke patients, how to confidently and reliably assess them in the field, and then to communicate their critical information via Medcom to the receiving stroke centers, such that we can activate our teams early and work in parallel with the paramedics. We go on site to the EMS stations on a quarterly basis to meet the new recruits and to make sure they're up to date with all the stroke protocols and the advances that have occurred in our field. And last month, just as a way to show thanks to many of the paramedics across the county, we visited them while still practicing, the social distancing and wearing the face mask, and thanked them for all their hard work and dedication to acute stroke care, and for all the other emergencies. They're really our front lines, and we count on them on a daily basis to answer the 911 calls. As the captain said, go to the homes and make sure that the patients that do need to come to the hospital feel comfortable and safe coming in. And so we're indebted for all the work that they've done to ensure the safety of our community.
Thank you, Dr. Mehta. And so we're going to go around and give our panelists this evening just a chance to give any final words of encouragement to our viewing audience. And we're going to start with you, Captain Esparza. If there's anything, sir, that we didn't discuss today that you do want to tell our viewing public, could you go ahead right now and just give them words of encouragement?
What I would like to say to the public is, if you have a situation where you feel you need to get evaluated by a medical team, please don't hesitate to call us. We'll come out there. We'll evaluate what's going on with you. You need to be taken to the hospital. We're more than happy to take you to the hospital. It's going to be safe. It's a safe environment for everyone, for us and for the patient. And it's better to be cautious on the side of error, It could be nothing, or it could be serious. But don't wait. Don't hesitate. Get it taken care of.
Thank you so much, sir. And Dr. Mehta, we're going to ask you now to give any final words of encouragement. And while you do that, if you could tell us if there's any difference in the masks that people wear. I know now it's almost become a fashion trend what mask you're wearing. And I kind of like that aspect of mask wearing, that we could incorporate it into fashion. But could you just talk about that, about anything that we should know about the mask that we're wearing, and any kind of final words you want to tell our viewing audience?
Right. So, there are a variety of different masks, as many in, our community have come across, whether in retail stores or online. The main thing to remember is, the types of masks that we use as part of our PPE in the hospital, those are the N95 masks and some of the higher level surgical masks. Those are not ones that, those in the community outside of the healthcare environment need to wear. The ones that are made out of cloth or any other material are sufficient enough to just filter the particles that we breathe in. And you have to keep in mind that in order to contract this virus, you have to have prolonged exposure to the virus in a concentration, in a sustained manner over several minutes. And so that's why these higher level masks, the N95 and the level 3 surgical masks, are particularly used just for the hospital environments. But those in the community, the routine cloth masks are just fine. And I just want to close by saying that, we saw a significant drop in our acute stroke and heart attack and other types of time-sensitive medical emergency volumes during the surge in March and April for this pandemic. But now it's more important that folks who are experiencing the signs and symptoms, please seek care immediately. Don't delay. We've seen a lot of patients come in that are beyond the treatment window for stroke, a day out, 2 days out, and then unfortunately we have nothing to offer them. So the main thing is time. Take it seriously. If you have chest pains or stroke-like symptoms, as the captain said, call 911.
Thank you so much, sir. And I can tell how dear that is to your heart, just by the way you deliver that information to us. I really appreciate all of the information that you've given us this afternoon. And we're going to turn over now to Mayor Messam. Sir, could you give your final words of encouragement to our viewing audience on our topic today?
Well, I'd like to thank all the community for tuning in for this episode of Conversations with Mayor Messam. I'd like to thank Dr. Mehta, as well as Mr. Esparza at Fire Rescue, for all that they're doing in our community. And pretty much what I really wanted to convey in this conversation to our residents is that there is no need to fear Memorial Hospital Miramar. It is as safe as ever now, especially in light of the coronavirus. If you are having an acute ischemic event like a stroke or a cardiovascular event like a heart attack, you cannot be afraid to dial 911. In fact, it's the best thing that you can do because it perhaps can save your life or perhaps your loved one's life. And as you can see, the collaboration between fire rescue and Memorial, your experience from when fire rescue shows up at your door to if you need to be transported to the emergency room, to the hospital, that it will be seamless, it will be informed, and there's collaboration and resources available to do the best to take care of you in that very crucial situation. So I'd like to thank our guests tonight for providing such valuable resources. Just a couple of reminders for everyone. As we are reopening and you're seeing the news reports, I know there's a lot of concern out there. And I would really like to stress to our viewership that Miramar, we still have emergency orders in place in terms of requiring the use of facial coverings. The City of Miramar's requirements are more stringent than Broward County, where it's optional or strongly urged. Where the City of Miramar, in certain situations like going into shopping centers and retail establishments, is actually required. And we feel that is important for our community so that we can ensure that when you are out and about, or if you are in public places, that you are protecting yourself and others are protecting you. So I know we're seeing folks out there that may not necessarily have masks on, but in the City of Miramar, we are taking every measure to ensure that our residents are safe. I would like, though, to, before I get to my final comments, is I saw a couple of comments that came across on the chat log about the immigrant community, those who are at the ICE facility, which is located in the City of Miramar. And the individuals that have posted the question are well aware that the ICE facility is not under the jurisdiction of the City of Miramar. Despite that, I would like to share with the audience that I personally sent a letter to our congressional delegation, the Secretary of the Department of Homeland Security, to have them to close that facility at the outbreak and the onset of the pandemic of the coronavirus in the City of Miramar. There are some concerns when that facility reopens. What will be the conditions of those residents? So we'll be sending communication out to them to find out what their protocols are going to be. The City of Miramar is not allowed to see these individuals who may be detained. We do not have jurisdiction over the facility, but we can and we will demand that there are humane measures taken to protect their lives as well, because their lives are just as important as everyone else's lives. So that I did want to make those comments out for the record so individuals can know that the City of Miramar does care for those individuals and have worked very hard in the instance of collaborating with the ICE facility in the City of Miramar with many concerns about those who may be detained. So in terms of our residents in the community, do know that the City of Miramar continues to make plans to reopen our governmental facilities and services to the community. We'll be announcing them very shortly in terms of our phase 2 and what you can expect for resources coming from the City of Miramar. Now, in 2 weeks for our next episode of Sean, we'll be having a topic on education. We'll be in the middle of the summer, and I have my special guest will be President Gregory Hell, the president of Broward College, as well as Superintendent for Broward County Public Schools, Bob Runcie. I know a lot of parents are concerned and have questions about the reopenings of schools and what that will look like. And we'll get the latest updates at that in 2 weeks on June 24th, as well as learning more about Broward UPS program with Broward College and their efforts and resources to train our residents and in the surrounding community in terms of resources, what the new definition of work looks like. You know, like right now we're meeting virtually. There are a lot of businesses and a lot of skill sets that are being reimagined in terms of what the economy and the necessary skill sets will look like in a post-COVID-19 environment. And there are a lot of resources to prepare, our residents through Broward College. So we're looking forward to that dynamic discussion. So stay tuned. We will continue to rise above this. We are one Miramar, and the City of Miramar is doing everything possible to help you survive the coronavirus.
Thank you so much, Mayor Messam. And what a great panel we had this afternoon. And thank you also to our viewers for tuning in today. Now, we definitely got some actionable steps that we can take to apply to our own health, to protect ourselves, the health of our loved ones, and the health of our community. We just want to let you know that for the most important up-to-date information on the city's coronavirus activity, visit us at MiramarFL.gov/coronavirus or follow us on social media at City of Miramar. If you have not already done so, we ask that you go to our website at MiramarFL.gov and sign up to receive our weekly emails, which will include updates from the federal government, from the state, from the county, and most certainly from the City of Miramar. And this always includes any resources we have available at the city to help our residents and businesses. Again, thank you for tuning in today. Join us again in 2 weeks for the next in our series, Conversations with Mayor Messam. Thank you and have a great evening.